My name is Srećko Gajović and I'm editor-in-chief of Croatian Medical Journal. I would like to present our cover page article, which appeared in our recent issue number 5 of 2011. Actually, this article relates to some new scientific data that appeared in other journals. For example, in Procedures of National Academy of Science of the United States of America, recently it was published a paper that connects the health of the person with its happiness. Actually, they name it positive affections. So if a person has more positive affections, or if we could say if it is happier, it was shown that actually at the end these persons would be healthier. And then there is a question, is it our own choice or is it influenced by our environment? And then we have another paper that recently appeared in The Lancet, showing actually example of Greece. Currently, crisis is looming in Greece, and it already lasts for some time. So, although it is actually growing on and the crisis is there, already in the last 2 years there was obvious influence of such a crisis in one country to the health status of its citizens. They actually asked more help of the doctors, and vice versa, what health system actually had to offer them was of lower quality than it was before. So if we consider this, actually the crisis affected the health of the citizens, which actually undermined the ability of the country to survive the crisis. How this relates to Croatia actually is at least partially shown in the cover page article in Croatian Medical Journal. This article actually deals with public surveys, public opinion surveys, which were connected with the elections performed in Croatia in 2005, 2007 and 2009. So these surveys have been carried by telephone, so the voters actually were asked about many questions, among them what actually they consider as a priority in Croatia. And surprisingly, although we can claim that the situation in Croatia was very different in 2005, in 2007 and 2009, very consistently the health issue was actually one of the priorities. In the elections of 2007, the health issue was the first, and in elections of 2005 and 2009, the health issue was the second choice of the voters at this time. This result actually conveys a very important message now, when we are in the eve of new 2011 parliamentary elections in Croatia. Although many other issues at the moment may be seen very important, this message that is constant from 2005, 2007, 2009 actually shows that most probably even today the health is one of the most important issues for the voters. And I guess this message is very important for the voters, for the parties, and for all stakeholders that are involved in the elections and in the creations of Croatian future. Therefore, we would like, from Croatian Medical Journal, having evidences, so this is evidence-based claim, according to the manuscript paper that is published in our last issue, to send a very strong message to consider health as a priority and to involve health in all the plans for the future as one of the really, really important issues.